Hello, friends, and welcome back to Rarely Typical, the podcast where I'm talking about living with a chronic illness, finding hope, and navigating a life that is rarely typical. I'm your host, Gerry Langan, and today I'm going to be talking about my experience navigating PAH or pulmonary arterial hypertension treatments, what I've tried, and what has actually worked for me. One of the questions I get asked all of the time is, what treatments am I on? What have I tried? How has it worked for me? Have I tried this treatment? And I want to answer all of those questions in a place that is concise and where it can be easily found again if somebody is looking for this information years from now. I have tried a bunch of treatments. I was diagnosed in September of 2018. Currently, right now, it's 2025. So it's been almost 7 years, and I have tried my fair share of treatments. When I was diagnosed, I started out on IV therapy. And when somebody that doesn't have pulmonary arterial hypertension hears IV, you think IV in the arm, you think an IV that they give you when you get picked up by the ambulance, you think of an IV that they put in your arm when you're in the hospital. And that is not technically what IV treatment for pulmonary hypertension means. IV treatment for pulmonary hypertension means medication that is delivered via a tunneled catheter in your chest. The tunnel catheter in your chest is considered a central line, and that line is placed in your chest. Mine was actually right here. I've had two of them, and it's tunneled from here and it sits right at the top of your heart. And that treatment is delivered via infusion pump. The infusion pump for a pulmonary arterial hypertension patient is actually very large. I will try to insert a photo here if you're watching this on YouTube. I'm not confident in my video skills yet, so you might have to bear with me. But the pump itself, if you are just listening to this podcast, is about the size of a brick and weighs probably about the size of a brick. It is very large. It is very cumbersome, and you are attached to this pump. I think the longest my line ever was probably about like 2 feet. You are always connected to it. You're connected to it 24/7, 365 days a year. You are not able to unhook from it. You shower with it, you sleep with it. It pretty much just becomes another part of your body. IV medication was not for the faint of heart. It was so difficult for me. There are very different types of medication that you can have delivered the IV pump. You can be on Flolan, you can be on Vomitry, and you can be on Remodulin. I was a Remodulin patient because that is what my doctor at the time prescribed. And I have stayed on Remodulin throughout my 7 years, and it has worked really well for me, honestly. My body loves the drug. It reacts very positively, and I'm very thankful that it has been developed because it has honestly saved my life. It worked so well being on IV because it was a direct line straight to the bloodstream, and I'm very happy that I was able to get on pump treatment immediately. Some people that are diagnosed sometimes are diagnosed more mildly and then do not start IV treatment immediately. IV treatment is kind of like worst case scenario, you now need to be on a pump because all of these other medications are not working. I was in a really bad situation when I was diagnosed, so we skipped all of the pleasantries and went straight to pump. I was told that, this is going to be something that you're going to be living with the rest of your life. You probably will never get off of this. It was really hard to grasp at the time because I did not think when I went to the hospital that day that I was going to be on this therapy for the rest of my life. I thought maybe I would be on it for a few years and then I would get off of it, but I just didn't understand, I guess, the gravity of the situation. And looking back, I wish that somebody had told me that. And, it's funny, I talk about it all the time, but I think one of the things that I wish somebody had told me when I started on IV was I wish that they had told me to go take a really long shower and wash my hair. And if you are on IV and you understand what I'm saying, taking a shower with an IV pump is so cumbersome. It was so difficult. You had to hang the pump up, you had to waterproof your chest. You could barely get water on it. Most of the time, I washed my hair in the sink. I never got to take a long shower because I was so scared and eventually traumatized that my line would get infected. And it would have just been such an easy thing to tell me, like, hey, you should probably go take a really long shower before we put this pump in. Because I wish later for showers. And I think that's the one thing I missed when I was on IV was that I just missed a good shower. I missed feeling like my hair was washed. I look back and really wish that somebody had told me. It did not work well for me long term because I got a lot of line infections. I had 2 very severe line infections, and because it is tunneled in your chest, you have to keep it sterile. So I had to put gloves on. I had to make sure the environment I was in was sterile. I had to make sure that I didn't touch anything before I cleaned my line, before I changed my cover. It was just a lot when you're at home and you have kids and you have a family and you're trying to just change the dressing and you have to make sure that the environment you're in is sterile. It's almost unfeasible to think about now looking back at it because it was so stressful. And I was only on IV for 10 months because I had 2 line infections in those 10 months. I had my first line infection because when they placed the line, I was allergic to the ChloraPrep that they cleaned it with. And then I was allergic to the adhesive that they put over it. And it was just like a perfect storm to create a terrible infection. And then the second line that got infected, they placed a line and I was allergic to the stitches. And then I was allergic to the dressings that I was still testing out. And I also just could not keep it clean. I was always trying to clean it, and I felt like my skin just could not cope with what I was doing to it. It sucked because I really wanted it to work because the medication actually was doing wonders in my body. I went from severe to mild. My pressures dropped from, I think my pressures were in the 90s and they dropped down to normal in the 20s. So my body was loving the medication, but my skin was not loving the treatment method. And so after my second line infection and seeing that my numbers were more normal, the doctors decided that maybe this treatment was not for me and then transferred me to an oral medication. Before I move on to oral medication, I do want to give you the pros and cons of being on IV. I think for me, the pro was that I always knew that I was getting the medication. And I will get into that later when I talk about the subcutaneous treatment that I'm on. But I think that knowing that I was getting the medicine, no matter what, was probably the most important for me. The cons list is very long. The cons were that it stayed in one place, that once it was infected, there was really no way around it. And the pump is very heavy. It made showering hard. It made living my life hard. It made quality of life very difficult. The list of cons is so long and it sucks because it is such a good treatment method, especially to know that it's working and to know that you're getting the medication. And if this medication does not work, at least you know you were getting it appropriately. So let's move on to oral medications. The first thing that I tried after I went from IV was I started on Orenitram. Orenitram is the pill form of Remodulin, and so I had gotten so much better on the IV that they decided we should just try oral medicine because I was so sick on the IV. I just could not keep my line clean and I kept getting infections. And so oral medicine just made the most sense. It was a step down from pump therapy. And it was a moment where I was like, I cannot believe I'm getting off this pump after I was just told I could not get off this pump ever. So I was super excited. We moved to the Orenitram in the hospital. I decreased my pump dose down to what should have been an equivalent to the oral medicine that I started. That is a whole different story. That is for a different time. But I switched to the pill version in the hospital. It took about 2 weeks to switch. And by the time I did switch, I got out of the hospital and I was probably taking somewhere between like 15 to 30 pills a day just to keep up with my dose. It was so difficult. And you would think that, like, okay, that's a high number of pills. That probably sucked. But really, it was just like my quality of life was so terrible on this medication. It is so hard on your GI. I was throwing up all the time. I was nauseous all the time. I was in the bathroom pooping all the time. And I just could not figure out what was wrong. And whenever I asked my doctors about it, they said that's just a side effect. Like, that's just what you're going to have to deal with. And it really sucked because I was hoping that eventually my body would get used to it and it would be fine. It never got better. I was on the Orenitram for probably close to a year, maybe 10 months on that too. And it was just really rough. It was just, I couldn't drink with my friends. Anytime I took a sip of alcohol, I was throwing up. Anytime I ate too much, I was throwing up. Anytime I ate anything, I had to go use the bathroom. Anytime I wanted to get up quickly, I was nauseous for no reason. Smells made me nauseous. Everything made me nauseous. My GI just could not handle the Orenitram. I was so sick all the time, and it took so much from my quality of life that honestly, I don't even think it's worth it to go back now. I have the ability to transfer to an oral right now based on the medication that I'm on, and I will not switch. My doctor and I have talked about it, and it just was so miserable for me that, like, I would rather be on pump than be on Orenitram because it just didn't work for me. There are other oral medications like Uptravi. Uptravi is like a similar medication, and it's just not as potent as Orenitram is, and it's not an equivalent enough of a dose for me to be able to switch. I've heard great things about it, but I have not tried it myself. I'm on other oral medications. I'm on ambrisentan and also tadalafil. At first, I started on sildenafil and it just wasn't strong enough, so we switched to tadalafil. The tadalafil and the ambrisentan were really hard with headaches. I was always constantly having a headache, but after a while, those symptoms went away. So that's what I was hoping for with this Orenitram is I was hoping after a few months my body would get used to it and the nausea would subside and the throwing up would subside and the diarrhea would subside, and it just never did. And when I ended up at Mayo Clinic after being in Alabama, I was still so sick that I had to go back on pump. So when we figured out that I had to go back to pump, it was like so emotional for me. I thought that I was better. I didn't realize I was as sick as I was when I got to Mayo Clinic. I did not realize that the oral medication was not working for me. And so when Dr. Moss told me I had to go back on pump, I was devastated. But then I also thought, I've done this before. I can do this. And I had the option of switching to IV, which I was like mentally preparing for that. But one of my friends mentioned that she was on the sub Q pump and said that I should consider it and maybe give it a try. And so I did a little research into it. She sent me a bunch of videos and I brought it up to Moss. I said, I think I want to try this sub Q, and here are the reasons why. Mostly for me, with the way my skin was reacting to the adhesives on IV, I just couldn't keep a line clean and I couldn't keep it from getting an infection. And so the ability to move my sites around with subcutaneous just made me feel more comfortable thinking that maybe that if after a few months I could just switch somewhere else, that it would give my skin a breather. And honestly, that has worked out really well for me. I switched to pump again. Gosh, it's been so long now. I think I switched to pump around September of 2020, and I have been on pump for over 4 years now, and subcutaneous has been working really well for me. The thing with subcutaneous is you never really know if you're getting the medication. So, I'm getting it in my skin, obviously. The medication runs from the pump into my skin. Sometimes I'm never sure, like, how I'm absorbing it. It has to depend on how your body absorbs medication, how fast it absorbs, all of that stuff. And then when I change a site and I squeeze it, medicine comes out. Like I didn't get that medicine. With oral medicine, I was throwing it up all the time, so I didn't know if I was getting it then. So that's a con. But for the most part, for me, subcutaneous Remodulin has been a completely different experience than being on IV was. It has been so positive for the most part. It is being back on pump, which really sucks. And at the time when I was told I had to go back on pump, I honestly was just heartbroken. But I knew that my body loved the medicine. And because of that, I was a little more optimistic about how it would go. Now that I've been on subcutaneous for about 4 years, I honestly think that my quality of life is like 20 times better than it ever has been, mostly because I'm able to keep my sites clean. I'm able to move it around and I'm able to do things that I wasn't able to do on IV, like cover it up and take a shower. I disconnect when I take a shower. I disconnect my tubing. I cover my site. I make sure that it's dry. And then I take a shower like a normal person. It might take a little longer to get ready, but the ability to take a shower and the ability to wash my hair, y'all, is like unreal. It is like heaven. And I remember the first day that I did it, it was like a dream. And I also disconnect to swim. And disclaimer that this is not medical advice, you should definitely talk to your doctor. But I disconnect for between 2 to 4 hours so that I can go to the beach, so that I can swim, so I can go out in the boat and do things with my friends. I put my sight in my arm, so sometimes I don't even disconnect from my pump because if I get in up to my hip, my sight's in my arm, so it's really not that big of a deal. But I disconnect from my pump and I can swim if I cover it correctly. And if my site gets wet, then I just kind of let it get wet and then I dry it out. Because the sites are diabetic sites, because the pump is a repurposed insulin pump, the tubing, the sites are all repurposed insulin things. I know diabetics who swim with their pumps. You know, they swim with their sites and they don't care if it gets wet. For us as subcutaneous Remodulin users, it's obviously important to keep it dry because of how long we're keeping them. It poses a risk for infection if you keep getting it wet or you get water in it, and it can cause an infection because we're keeping them so long. With diabetics, they keep them for like 3 to 7 days. But for us, we're keeping them, I mean, hopefully for months, right? I'm getting about 4 to 6 weeks out of my sites, and I'm so thankful for that. For a little while there, I was not sure that this was working for me. I was having such a hard time with adhesives. My skin was just not agreeing with anything and still not agreeing with anything, but I'm on an injection for allergies called Dupixent, and it has done wonders for my skin. It has helped me with my adhesives so much. And now I'm pretty much able to use the adhesives like a normal person with normal skin is. And it has worked so well. So now I'm able to keep my sites longer. So I'm less stressed. I feel like I'm less worried. And it has been so great. But the downside and the biggest con I think everybody has with the subcutaneous Remodulin pump is that it causes a lot of pain. So, from my non-medical understanding, the medication causes a histamine reaction in the subcutaneous tissue of your skin, and it causes this inflammation, and the subcutaneous Remodulin users call it Hell Week. And for the first 10-ish days, mine are 10 days. Some people have pain for like 14 days. So it just really depends on the person. So for the first 8 to 10 days for me, the pain is almost unbearable. I need a narcotic. I take a Percocet. I use compression. I use ice. The Dupixent helps. I take a Zyrtec because it's an antihistamine. I put Flonase on it because that's an antihistamine. I do pretty much everything I can to keep the pain at a minimum, but it honestly is still really hard. Hell Week is really debilitating, especially if you were using a site in your stomach. When I have done it, I cannot even move. I can barely breathe without pain, and I cry every Hell Week. Even now, when my pain is minimal compared to what it used to be because it's in my arm or my hip, the pain is still pretty debilitating, and I still cry. probably every hell week because I just don't want to deal with it anymore. The pain sucks. But for me, mentally, I can do anything for 10 days. And also, right now I'm getting 4 to 6 weeks. So it's once every month and a half. I can do that. When it comes to dealing with pain for the subcutaneous pump, it's probably the question I get the most when it comes to like how I'm treating my pain. And I am very fortunate that my doctor understands the type of pain that comes with a subcutaneous Remodulin pump. And he understands that it's debilitating and he trusts me when I say it is awful. So I am prescribed a narcotic, but I know that there are a lot of providers that are not comfortable prescribing people narcotics, and those people have to go to palliative care. I recommend going to palliative care if you have a physician who is not comfortable prescribing you a narcotic. It is very difficult to get through. And honestly, I do not know how anybody gets through Hell Week without a narcotic. I take a half of a Percocet because I don't really like the way the Percocet makes me feel. It makes my heart race, but I could not get through sleep without a whole Percocet during Hell Week. I don't know how anybody else functions without it. Something else that has worked really well for me for dealing with pain is I am now alternating sites. And when I say that, people are like, what does that mean? So I was told by somebody on the internet that in Europe, some doctors recommend alternating sites. And so I was like, I will literally try anything at this point. So the way I alternate sites is when my old site starts to wake up, as we call it, when it starts to ache again after it goes to sleep. So after Hell Week, it goes to sleep essentially and no longer hurts. And then when it starts to wake up again, that means that it's going bad and that it's about time for a new change. So when my site starts to wake up again, I place a new site. Mine, I prefer on the other side of my body. It is not fun during alternating sites to have 2 sites to worry about, but it does help, I think, with the pain tremendously. So I place a new site on the other side of my body when my site is going bad, and I alternate. I think there's a video somewhere on Instagram of how often I'm alternating, but I think it's usually between like 12 hours or 24 hours, depending on how the sites are feeling at the time. So I start a new site. I hook my tubing up from my old site to my new site, and then I put a cap on my old site and I let the old site rest. Once it rests a little bit, it kind of starts to go back to sleep and my new site starts to hurt. And when my new site starts to hurt, if it hurts a little bit, I leave it. But if it starts to hurt a lot, I switch it back to the old site that has now gone to sleep. So no longer hurts as bad. And I alternate for probably, I don't know, 3 to 4 days, maybe like 3 to 5 days. I think the most I've alternated was like 6 days. And it honestly just gets me through the worst part of Hell Week. And for me, Hell Week is 3 to 5 days is the worst pain. And when I can get through that, then the rest of the time is not that bad. And I honestly have done alternating sites and not needed to take a narcotic, which is huge. It does elongate Hell Week a little bit. Instead of like 10 days, because I'm alternating, I'm actually keeping my old site and my new site. Hell Week ends up being like closer to 14 days versus 10 days. But I will take an extra 4 days if I'm not taking a narcotic and I'm not in debilitating pain. Most of the time when I'm alternating sites, I'm able to just function as normal. And I think it's a great method and it has worked really well for me. Another pro that I think has to do with the subcutaneous pump versus the IV pump is that the pump itself is tiny. It's about this big. It's a repurposed insulin pump, so it's very small, easy to carry. Sometimes I just tuck it in my bra. The IV pump I had to carry in a book bag or a fanny pack, a very large fanny pack, was just very cumbersome. It was just so heavy and it just sucked. But the subcutaneous pump I carry in a little pump belt. The new pump, the Remunity, is smaller than the one that I have, and people just clip it to their pants. They clip it to the inside of their bra, and I am not looking forward to switching to the Remunity, but I am looking forward to not having to wear a pump belt. Sometimes the pump belt in the summer gets really gross because it's, like, sweaty and across my midsection. The only reason I'm looking forward to switching to the Remunity is the size of the pump. But for the most part, the size is a big difference because you can sleep with it on. You don't have to worry about getting tangled in the tubing and any of that stuff because of the size and like where you're able to wear it versus where you're able to wear the IV pump. All in all, those are the therapies that I've tried. I've tried everything from IV to sub-Q to oral. There is another type of treatment for PAH called inhaled therapy, which is Tyvaso, and I actually have not tried it. I would love to switch to Tyvaso. I would love to switch to an inhaled therapy, but just right now, I'm not there. I have not been able to do that because my dose is so high on the pump right now. The sotatercept that I'm on, if you didn't know, I'm in a clinical trial for a drug called sotatercept, which is an injection, which now is a new treatment therapy for PAH. I have been on the trial for the last 2.5 years, almost 3 years now, and it has done wonders for me. It is an injection that happens once every 3 weeks, and mix the medication at home by myself, and then I inject it myself. It has done such amazing, incredible things in my body. It has been a complete godsend for me. I have never felt better. I'm having a lot of nosebleeds because of the injection and skin problems. My skin is unreal, and I've gained a little bit of weight, and it does enhance all of the other side effects for all of the other medications that I'm on. However, I will take all of those things for feeling the way that I feel. I feel so much better. My numbers are so much better. I am so stable. I have never been this stable before. I've never been this stable at this level before, and I'm so thankful for it. The injection has been so good to me, and the clinical trial has been great, but, there are side effects to every drug. I have not tried inhaled, but that is something I'm hoping that with the injection, I will be able to do someday. Anyway, to make a long story short, thank you for being here. Thank you for listening to this podcast. I hope that this was helpful in some way. I hope that you got something from this if you are a patient. And if you're not a patient, I hope that you're a medical provider or a nurse and that you are looking at this and you're listening to this and you're thinking, wow, that is so cool to hear about somebody that leaves the hospital and this is what they're doing now. I am so thankful for every single one of you and everything that you do. I am so happy that you're here. And if you are new here, please subscribe, please like it. I'm so thankful for this community and everything that you guys are doing to support me. And until next time, friends, I will talk to you then.